Hello, my name's Scott Newhouse. I am your host, and welcome to Retirement Clarity Radio. You can find the show at retirementclarityradio.com, and then you can also find it on YouTube. Just search my name, Scott Newhouse. This is episode 2 of Retirement Clarity Radio, and what we're going to talk about today is the difference between Medicare Advantage and Medicare Supplement. As we talked about in the first episode, 3 key things to know about Medicare. We do know that original Medicare Parts A and B do not cover all of the services that you might want for your health insurance coverage in retirement. And so that's where Medicare Advantage and Medicare Supplement comes into play. So let's just dive right into it. We'll start off with original Medicare, then we'll talk a little bit about Medicare Advantage, then we'll talk about Medicare Supplement, and then we'll get done with this episode so you can move on with your day. As I just said, original Medicare is Parts A and B, and that is insurance coverage for mainly things like hospital visits, doctor visits, preventative care, those types of things. And I should also mention, if you want to get more detail about Medicare, you should pick up my book, 10 Steps to Getting What You Deserve, a guide to your Social Security and Medicare decisions. That's going to be available in the show notes for free, and you can get a PDF version, or you can buy it for a whopping 99 cents on Kindle. But as I mentioned in the last episode, original Medicare Parts A and B does not cover everything, and let's just go through what Part A Medicare covers. It covers things like inpatient hospital care, skilled nursing facilities, surgery, some home health care, some lab tests, as well as hospice. And then Part B is more of preventative services. And again, Medicare has a great list of what's included and what's not included in Parts A and B. So if I'm going too fast, or if you just want to kind of review the information, just type in Medicare, Parts A and B coverage, and that's going to have a list of what exactly is included in Parts A and B. And then transitioning to Part B is the preventative care, as I said before, and it covers things like doctor's visits, outpatient care, some durable medical equipment, some home health care, as well as some other preventative services. Now, Parts A and B, again, is original Medicare, and you need to sign up for that, and you need to sign up for it within your Medicare eligibility window so you avoid any late fees and late penalties, which are frankly really punitive, especially for Part B. Now, if you go through that list and you say to yourself, or you say to your spouse, that's not enough. We want more coverage. Then you do have options, not requirements, but options to get more coverage. As I mentioned in the last episode, Part D is going to cover prescription drugs, so you can get some help to share the cost of prescription drugs in retirement with Medicare Part D. Now, if you need even more coverage, especially for this following list, then you'd want to look at Medicare Advantage or Medicare Supplement / Medigap. So let me go through the list of what's in original Medicare and what Part D prescription drugs do not cover. So there's no coverage in original Medicare for this. Acupuncture, most chiropractic services, cosmetic surgery, dental care, dentures, eye exam, foot care, routine foot care, hearing aids or fitting appointments, long-term care, that's a big one that is not included with original Medicare, and then most traveling outside the U.S. And so again, you look at that list, and especially you look at the list of what's not covered, and you say to yourself, boy, I don't want to pay for all of that out of pocket in retirement. Let me see if I can find an insurance policy that will help me out. That's where you're going to have options through a private insurance company, and you can either purchase a Medicare Advantage plan or a Medicare Supplement / Medigap plan. Both optional, and let's go through Medicare Advantage first. So Medicare Advantage is essentially an all-in-one type solution for Medicare. So it will combine original Medicare A and B. It'll include services that were not included in A and B, so you'll get some additional services. And then depending on your plan, you actually might have prescription drug coverage in your Medicare Advantage plan, and that's Part D. So all of that would be included in one service. There are some limitations, though, with Medicare Advantage plans. One of them is that they're often regional plans. So it might be one specific state that your coverage is counted for, or it might be a specific region of the country. But you do need if you do plan on travel or relocating in retirement, that's really important that your where you live or where you're traveling has coverage for your health insurance. God forbid something happens to you. You want to make sure that you have health insurance coverage when you're doing those traveling. So that is a big downside of Medicare Advantage plans. Also, you should note that there might be extra cost involved with the Medicare Advantage plan since you're covering things that aren't original Medicare, and you might be getting prescription drug coverage. So you should definitely run the quotes, shop your options on Medicare Advantage plans, and see how much extra it would be. And that's pretty much it for Medicare Advantage. You definitely want to run the numbers, and you definitely want to have a good understanding of what extra services your Medicare Advantage is, what limitations there are in terms of where the coverage is going to be. And then you also do need to remember that Medicare Advantage plans can change every year. So when you come up towards the annual enrollment and you have the option to pick a new Medicare Advantage plan, you want to check your plan that you selected and make sure that it still covers everything that you want. Okay, and so that's Medicare Advantage. And again, if you want to learn more, if you want to see it in a book format, you should really pick up my book. It's a really good one if I do say so myself. So the next option that you have, and again, it's an option, it's not required, is Medicare Supplement. It's also called Medigap. Now, this is more coverage, and with it, obviously, it is more cost. And here's some of the things that Medigap/Medicare Supplement can cover. It can help you cover additional days for inpatient hospital care, skilled nursing care. And this is a really big one. Coverage when traveling out of the state or the country, depending on the plan. So you can really do a lot of traveling and have your Medigap/Medicare Supplement plans cover you, which is, frankly, it's pretty big for a lot of my clients. A lot of them really want to do some traveling and not having to worry about the travel coverage. That's a big component of what their selection is for health insurance. You also get 365 days of additional hospital coverage after you run out of Medicare Part A's covered days. That's pretty cool. And again, there's going to be a higher cost with that, but you're going to get more benefits from it. Now, the plan names are a little weird. They go from A to G, like Medicare Part A, all the way up to G, and then K to N. And so you can look through those plans. And again, Medicare actually does a really good job of explaining these plans, and you can see what would be covered and what the cost would be. Now, Medicare Supplement/Medigap plans do not cover everything. So they do not cover prescription drugs, they don't cover routine dental, vision, hearing appointments or services, or long-term care services. I need to make a quick note about the long-term care services. That's a big misconception for some people. They think that Medicare covers long-term care services. That is not the case. There might be some limited services that you would get, but if, God forbid, you're in some kind of nursing home facility, or you need a nurse to come to your home for an extended period of time, for all months and honestly even years for a lot of people, that's going to be a long-term care insurance policy that you might need to consider, which is going to be separate than your Medicare/health insurance policy that you can select at age 65. So something to note, something to put in your, in the back of your brain. Let's think about long-term care insurance coverage and if it makes sense for you. Now, wrapping up on Medigap, there's going to be two separate monthly payments. There's going to be one for Medigap, and then there's also going to be one for Part B. So you're going to have multiple payments that you're making for those multiple coverages that you're having. Also, your premium is going to depend on your age, your gender, location, and the specific plan you select. You also have a choice in the deductible. And as you know, a higher deductible is going to have lower monthly payments, and a lower deductible is going to have higher monthly premiums. So just something for you to consider and think about as you look through these plans. Let me do a quick recap of what we've talked about today, and then we'll get out of here. So Original Medicare Parts A and B does not provide comprehensive health insurance in retirement. If you want better coverage and more coverage, and yes, you're going to have to pay for it, then you want to consider a Medicare Advantage or a Medicare Supplement/Medigap policy. Those are optional plans. They are approved by the government, and they but they're run by private insurers that the government says, hey, these plans have met the requirements to be able to be a Medicare Advantage or a Medicare Supplement plan. Also, you really want to make sure that you're checking for annual updates in your plan to make sure that the coverage still matches your needs. And that's pretty much all we got for today for the differences between Medicare Advantage and Medicare Supplement. Again, if you want to learn more, you need to pick up my book, 10 Steps to Getting What You Deserve, A Guide to Your Social Security and Medicare Decisions. That's going to be in the show notes, which you can find at retirementclarityradio.com. And then you can also find me on YouTube. Just search for Scott Newhouse. I hope you have a great day. I'll see you next time. Thanks again for listening. As a reminder, you should consult with a financial advisor familiar with the specific circumstances of your unique financial situation before making any financial decisions. Nothing in this podcast is a solicitation for the sale or purchase of any securities. Any mentions of rate of return are hypothetical in nature and not a guarantee of future returns. Scott Newhouse, CFP, is an investment advisor representative of Forthright Finances, a California and Nevada registered investment advisor.